Health education on cervical cancer locally often neglects to mention the role of men in sexually transmitting the human papillomavirus, which commonly causes the disease in women. Coordinator of the VIA program at the Ministry of Health, Dr. Martin Campbell, during an exclusive interview with this newscast, put emphasis on male involvement in the fight against the leading cause of cancer deaths in women. He pointed out that while there are other factors that make women and girls susceptible to developing cervical cancer, such as early sexual intercourse, history of sexually transmitted infections, and others, HPV has proven to be the leading cause locally.
When we're talking about sexually transmitted infections, that increases, of course, once you're having multiple sexual partners, once you're having unprotected sex. So that's one part the male counterpart can play, reducing sexual partners, being monogamous and having safe, healthy sexual practices. Also, the man can also encourage his partner to get tested, because ultimately you're looking at the well-being of your partner and your family.
The human papillomavirus can be transmitted from an infected man to an uninfected woman through sexual contact. Cervical cancer develops slowly and may be present for several years before symptoms start appearing. Dr. Campbell opined that owing to the delayed symptoms for someone who may have the ailment, the disease is detected at a later stage.
The tendency among Guyanese population is to go to the doctor when they have an issue. So women tend to, go for a checkup when they notice something abnormal down there. And unfortunately, in the case of cervical cancer, when that happens, it's already a stage 3 or a stage 4 cancer. So that is a struggle that we're dealing with, to sort of change that mindset among the population, to get screened, to just, a random checkup.
Cervical cancer currently has an estimated 32.7 incidence rate per 100,000 and a mortality rate of 17.3 in Guyana. In addition, 70% of all cancer patients in the country are diagnosed with cervical cancer. In 2012, the government of Guyana, in partnership with the United Nations Children Fund, launched a national HPV vaccination campaign for schoolgirls between the ages of 11 to 13. According to UNICEF, some 21,600 girls were vaccinated. At the time, the girls were required to receive 3 doses of the vaccine in order for their immune system to efficiently fight off the HPV virus. To commemorate the month's observance, the Ministry of Health is collaborating with the Guyana Telephone and Telegraph Company on a number of outreaches.
We should be in the West Bank of Demerara at the Good Intent Health Center. On the 20th, we would be in Rossignol, Region 5. On the 22nd, Mahaika, at the Mahaika Health Center. On the 25th, we'll be going to the Kurukuru Health Center as well. And between the 27th and 29th of January, we'll be in Region 8 in Madia.
Temika Rodney reporting for the HGB Nightly News.